And finally, to end this Health from Life session, we need to talk about exploration, but also education. And I'm very, very happy to have our next guest. Our next guest is going to take us into the world of revolutionary 3D exploration of living cells. And guess what? In 3D. Yann Cotte is a serial entrepreneur that I've been following for, I will not count the years, an innovator in bioengineering and microscopy, holographic microscopy, with a passion for science since he was a child. He's a co-founder and CEO of the Nanolive company. In 10 years, Nanolive has become a leading provider of live cell imaging and analysis solutions, revolutionizing microscopy and advancing scientific research in biology and medicine. Please join me in welcoming Dr. Yann Cotte.
So, hello everyone, my name is Yann Cotte. As Patrick said, I'm co-founder and CEO of Nanolive. I have dedicated my working life to developing the Nanolive platform, which to my mind combines two of the biggest trends in our lifetime. So on the one hand, the ability of collecting data from living cells without manipulating them, and this on a subcellular level, and on the other hand, the ability of directly analyzing them with the help of AI. This is where we can empower biopharma to compress their work streams. So today, I would like to share with you the journey, the entrepreneurial journey on which we have been on. So quite simply, we are all made of cells and all life happens on a cell level. So you can think about fertilization, you can think about our immune system, you can think about the remodeling of our neurons, as you're listening to me, infectious diseases, cancer, aging, and so on. Therefore, being capable of directly interacting with living cells or experience it would open a wealth of unlimited possibilities. However, cells are transparent, and this is why it was until recently impossible to directly see inside living cells without damaging that. And this is the fundamental limitation we overcome with Nanolive. And I would like to start this on a very personal note, so in the beginning of our entrepreneurial journey, and this starts from photonics to cells. So by education, I'm a physicist, and my story, or the story of Nanolive actually began back in 2007 at EPFL, which is the Swiss high-tech institute in Lausanne, so based at the shores of Lake Geneva. And you see, using traditional microscopy to see more living details is based on chemical markers. So quite simply, you can't directly experience the living cells, but you actually experience a proxy that, so say a blue color, a dye that you put into the cell to color the cell. And so if you were with this technology, the traditional, the legacy technology, to increase the living details you would like to see, it requires inputting more energy and disruption into the cells. It is expensive both in time and money, and ultimately leads to lower significance in output. But during my PhD at EPFL, we had the chance to make a fundamental discovery in physics, which allowed for the very first time to actually see inside living cells without damaging them. And this is what we consequently published in Nature. And actually, it was a discovery not related directly to cells or biology, but microscopy on actually to see shorter than the wavelengths of light. So this is where we use, this is what you can see on this slide, this is where we use these nanoholes to actually characterize that we effectively can image shorter than 100 nanometers, so shorter than this resolution limit. And it was only during the peer review, actually, for the Nature journal, that a reviewer from Johns Hopkins University asked us, okay, guys, have you actually tried looking at cells? So, I mean, you know, obviously I didn't want to make him upset, so I walked over to the neuroscience department and get some samples. And this is what you actually can see here. And when we published, I expected some resonance, obviously from my peers, from the physics world, for the principle of overcoming this resolution limit. But the real resonance came from the world of biology. And it took me some time to understand, but actually for them it was the first time. You know, they were always told it's not possible, you have to use this proxy technology, but for them it was the first time that they could actually experience the cell as they are, 3D, and alive. So that's all the dynamics aspects that we want to show. And then back in 2013, based on this very same innovation, we created and incorporated Nanolive SA, since we realized its potential to fundamentally change all cell-based industries. And what you can also actually see on this slide here is on the left picture down there, that's our first prototype. So the first lab prototype we had to show the proof of concept. You can see there was actually a bus-sized microscope. So me and my colleague, we were literally standing or sitting inside the microscope. And today, this has been commercialized to a bench-sized instrument, so which can sit anywhere in a lab. And in the future, we can even scale this down another magnitude. So how does it work? I won't go too much into details, but just to give you the gist of it, Nanolive provides a solution for in vitro imaging. So you can imagine cell cultures that are sitting in some plates, typically 96 well plates. And just as you may know from an MRI, we have a cell-size patient, very small, which we scan from all possible angles, so 360 degrees, and which encodes then the diffracted signals into a series of holograms. So we have a series of holograms that is reflective of each angle. And in this matter, we can instantly deliver 3D reconstructions of living cells without any special preparation. And in fact, what we measure is how light interacts with the matter of the cell and is actually slowed down in the cell. And what we reconstruct, so what you see here as a contrast, is a physical marker of the cell. It's actually the cell itself in the sense of refractive index. And the big discovery that we didn't anticipate, and that I'm pretty sure also the reviewer from Johns Hopkins didn't realize, is that this physical signature, the refractive index, just happen to coincide with the biological entities, so the composition of the cell. And when we talk about 3D, we can actually cut through the cell. That's what you see on this plate here, and then we can literally look inside the cell. And when we look inside the cell, we see its inner workings. We can identify its composition, so you can see mitochondrial network within the cell. You can see the lipid droplets, which obviously, as we heard from Moderna, can play a crucial role. Also, the lipid packaging for delivery of drugs. You can see the cytoplasm, the nucleus, the nuclear membrane, the cell membrane, vacuoli, and so on. So we have a highly multiplexed signal. And now to the second part. And the second part, so we can access the cell as there is, alive in 3D. And when I was thinking about the second part, I actually thought back when I first met Patrick about 10 years ago, probably a decade ago, in your office. And you mentioned Galileo to me. So, and his telescope. And as you may know, Galileo had back in his days, 17th century, the most powerful telescope. And the telescope for observations illustrates how a tool for seeing and collecting evidence and experience our reality can dramatically change our understanding of our world. So with that in mind, you know, on our second part of our entrepreneurial journey, we ask ourselves, okay, now that we can interact with this hidden kingdom of life that surrounds us all and we can now access directly, we can experience directly, what could we actually discover? And that's the second part of our entrepreneurial journey, where we went from cells, or we try, you know, that's where we are today, from cells to patients. And quite simply, when cell intactness is key, our hardware platform today delivers and collects the highest cellular information density anywhere available on this planet. We can argue about this, But I would argue that we have continuous data for an arbitrary amount of time. You can image your cells, you get 3D data, you get multiplex data of this multitude of organelles within the cell. So we get a very, very high content information of our cells. So it's a challenge, but it's also an opportunity, because to make sense of this enormous amount of information and to answer specific questions that we want to address in our therapeutic applications, we actually can harness and use the power of AI, cell biology, to quantitatively extract the key metrics that are today maybe the bottlenecks in bringing these therapeutic applications to patients. Now researchers can, with this combination of two technologies, label-free live cell imaging and AI, for the very first time see and precisely measure, so quantitatively measure the impact of their drugs and stimuli. And in this example, what you can actually see is, that's an example of the world of immuno-oncology. So you see a co-culture where you see the cancer cells and the T cells directly interacting amongst them. And we used this in the beginning when we were showing what we do, showing that you can now directly see cells, and then pointing out, look, there 3 cells are killed by it, and look at these interactions. But the benefits of then applying AI to it, you can characterize all of these interactions at once, and you can actually scale your perception on all of the interaction stages on a big population of cells. And in this way, characterize the entire chain of interactions between these two, from find, bind, stress, kill, and even serial kill. So in the next slide, what I'm happy to report, maybe after we had discussed 10 years ago, is some of the discoveries, some of the insight that we could gain on this entrepreneurial journey from cells to patients. Okay, so today Nanolive is recognized as a leader of the global market for non-invasive. Sorry, there's again a little bit of a mix-up, sorry. So it's recognized as a global leader for the non-invasive live cell analytics. And to give you a taste of where we stand today, so we have about 300 plus microscopes in the field, which is the majority of which is deployed actually in academia, academic research institutes. But we have actually our fastest growing market segment coming from biotech and pharmaceutical applications. And today we have a product suite which is uniquely fit for purpose for applications in these industrial applications. And if we look at the biopharma users in drug discovery, this is where you can see how we position. So you can see here a typical drug pipeline where if you want to bring one drug to the market, successfully to the market, one normally needs to screen through about 10,000 plus chemical compounds in the beginning, so you have this very strong funnel. This is a very long process, in average 14 years, and with more than 2 billion costs per drug. So Nanolive can be deployed in this process in a preclinical phase, so when you think about cell-based assays, to actually increase translational relevance. And this is because we can work with unimpaired high content data. So it is not only that we don't damage our cells because we don't need to rely on these chemical stains, but by not using the chemical stains, we can also work with the most sensitive cell lines. So you don't have to rely necessarily on dead cells or immortalized cell lines, but you can directly work with very sensitive cell lines like iPS, induced pluripotent stem cells, or primary cell lines. The second argument is we can, with the help of AI, actually create quantitative data on mechanism of action. And our solution is fully integrated into existing workflows of biopharma companies. So we use all of our experiments actually based on 96 world plates, where you can run for an unlimited amount of time, these digital assays, these AI-based analysis, and also for an unlimited amount of time, so very long-term continuous experiment to, in the end, generate the lead candidates. And in the next slides, I would like to show you a couple of candidates on examples on how this looked like. So here is the first example, which is cytotoxicity and cytotoxicity assay, which is the most ubiquitous assay in drug development. And we developed the assay for scientists working in pharmacology and toxicology departments, so that our live cell data can help them determine the safety and toxicity of drugs. And directly on the most sensitive cell lines, as I said before, primary cell lines, iPS, or antibody-producing cell lines, so you can also think about clones, or even patient-derived cell lines. And this eventually helps to increase in vivo translational relevance of drug candidates, to reduce the need of animal testing in the later stages, and to increase confidence that the candidates that eventually move into clinical studies are right and will not fail. So on this slide, you can see the different workflows as we move from our raw data. So that's the input that you see there on the left, which typically is data on a mesoscale. That means we can characterize in our 96 well-plate conditions cell populations down to individual organelle ecosystems. So that's our input data there. And the first step why we use AI is to segment the cells versus the background. So we can actually segment the individual cells continuously, and this constitutes then the unit in which we characterize our cell population. And the second step, the classification, consists in a machine learning model which we trained to predict the state, the vitality state of the cell. So we can actually associate a probability of each cell being alive, not so much alive, very dead, or about to be dead. And this, in the end, allows us a classification, so a prediction on the cell fate of each state, which allows us to look deep into the cell health as a function of the drugs and the stimuli applied to them. And to give you a little bit of a taste of this, so cells can actually die in a multitude of different ways. And normally a classical assay, that means based on chemical stains, would give you an output, okay, the cell was dead. But it couldn't necessarily differentiate between the mechanism that led to the death. And the way a cell dies can have an enormous impact on the organism, which plays a critical role in assessing the risk of undesired side effects. So arguably, it is key actually to identify the capacity to identify different cell death mechanisms. And AI-based scoring allows to directly differentiate them label-free, so again, without interfering with the state of our cells. And here you can see two examples on how this looks like. So on the left side, you see the predominantly apoptosis cell killing. So this, you can think about it as the programmed cell death, sort of a suicide for the greater good of the organism. And on the right side, you can see a very different dynamics, which is directly recognized and picked up by our AI, which is a predominantly necrosis case. So this would be missed with traditional assays, and that's what we can directly bring on the table by applying AI. And in this example, on this slide here, you can see an example from screening. So in this example, actually to measure dose-dependent effects of different drug candidates. And this is a scalable process, so at large with data, which can be completely automated, and which is actually today completely automated in our solutions. So it's a walk-away solution. You can acquire data over an arbitrary course of time. In this case, you can see 45 hours. And this can be then deployed for multiplex conditions, so you can duplicate your conditions in different wells with your concentrations. And since it can be used for an unlimited amount of time and assays, it actually offers the unique possibility to directly measure the impact of drug compounds. And this is very interesting because if you think about your information bias that you have, and you have to make assumptions about the time scale on which you would observe your impact and the mechanism of action of an unknown compound, this is obviously something you wouldn't know in the beginning. So with our technology, you can directly observe without any information bias and see the different time scales already on the mechanism of action which are of interest. So that's the example from cytotoxicity, so a question of life and death for cells. Here the other example I would like to share with you, which I already showed in the beginning, is from the immuno-oncology, where we are addressing the space of cell therapy in this immuno-oncology based approach. And the therapeutic approach here is to extract immune cells, so specifically effector cells, the T cells, from cancer patients, train them to recognize the T cells, to recognize the cancer cells and target them in order to eliminate the cancerous cells. And AI cell biology can be used to find the best therapeutic candidates. So how does this work? Here you can see the cell population, and you can see that we already used the AI for the classification, so the segmentation and the classification to actually distinguish in a co-culture. So we have, in this case, not an homogeneous cell population, but this mixed one. We can see the target cells here highlighted in blue. You can see the effector cells, the T cells, highlighted in yellow, and in red. And actually in yellow you can see as soon as they get into interaction between these two cell lines. And after the initial stage of finding, the next stage of this interaction between the two cell lines is the bind. So which can be described by increased time of contact point. So all of everything that we are describing here is obviously automated in terms of analysis, and then we can define very properly the different stages of interactions between these populations. And this binding phase should then lead to a cellular stress. So ideally the desired outcome is that the target cell population gets stressed, which eventually should lead to a cell killing of the cancerous cells. So that's then the final stage of the interaction is to assess how well the target cells are eliminated. And in fact, our live T-cell assay is today the only solution which allows you to simultaneously score the entire process from find, bind, stress, and kill, and ideally even down to serial kill. If you want, the legacy technology would be to look at static, so dead cells, and you would actually every time only get a snapshot of these interactions, while with our technology you can in one run look at the entire chain of interactions. So you can score the effector cells directly on the target cell type populations, and this with an unprecedented level of quantity and quality of readouts, and even down to the individual immune synapse level. And since we are label-free, the overarching promise here is also that this cell culture can be, after being characterized and chosen, even be transferred back to the patient afterwards. So as a last example, I would like to show you an example from the field of regenerative medicine. So here you can see actually stem cells. You can actually see a stem cell population, so which you can induce to differentiate into different types of cells. And in this case, it is induced, what you can see here is the entire differentiation process from a stem cell to the intermediate stages to into neurons, which then can, on the flip side, serve as a disease model for central nervous system, so CNS. So in conclusion, the possibilities are as endless as the possibilities for a stem cell to differentiate. From advancing drug development to personalized medicine, from understanding the impact of environmental changes to unlocking the secrets of cellular aging. The integration of Nanolive's data acquisition with AI analysis has the power to reshape the landscape of scientific exploration and experience. And with this integration, we can embark on a journey of scientific discovery like never before. Imagine the possibilities when combined with unrivaled intelligence of AI systems designed to push the boundaries of human understanding. It possesses the ability to analyze vast amounts of data produced by our microscope, by our hardware platform, swiftly identifying patterns and correlating and find correlations that may have been missed even with the most skilled human eyes. So our microscope does not only capture and reflect on the inner working of living cells with an unprecedented level of resolution, but combined with AI, it has the power to unlock the hidden secrets held within cell biology. So that's Nanolive, what we hope is the future of life cell exploration. Thank you very much.
Thank you very much, Yann. Now I understand why you call it Nanolive. So it's amazing to see in science that every time we have new tools to observe the world, we find new things. I noticed that your logo is a little bit like that. So I interpret it like observing the world and then doing the analysis and representation. Why did you choose that logo?
Because it's not quite clear what it all could mean. You know, that's one interpretation. But another one, you know, it's infinite possibilities if you look on the right way on it. But it's also a closed loop.
It is a loop.
Yeah.
Just a loop. So thank you very much. We have time a little bit for questions. Are there any questions in the room? I have one, maybe. I understand you started off in education, and we can understand very well why, because in 3D it's much more, obvious to understand than in pure 2D assays. And now you're expanding to pharma. What is the, if you can share that, the mix between the two right now?
So I think if you look at the entire unit install base, we have about 10% presented in biopharma. But if you look at the growth rate,
the growth is there.
It's exactly, it's there. And the type of product that we are placing in these markets is actually quite different, because in biopharma we are placing the solutions, while we can place microscopes in academia.
Okay.
Yeah.
Thank you very much.
Yeah.
Let's thank Yann Cotte again. Thank you very much, everybody. I think it's now time for lunch. The lunch break will be up until 2 o'clock. Join us for drinks receptions this evening, you will see. The day will continue at 2 o'clock. Be sharp for our next session, because we will turning our attention to industries with the revolution of virtual twins of systems and the complexities associated to them. See you then. Enjoy the lunch, and let's be back sharp at 2 p.m. Thank you very much.